Herring, including fresh, pickled, and matcha-style preparations, is often viewed as a traditional, nourishing fish with a strong nutritional profile. It provides high-quality protein, substantial amounts of long-chain omega-3 fatty acids, vitamin D, selenium, iodine, and several B vitamins that support cardiovascular health, thyroid function, and energy metabolism. In many cultures, herring is eaten regularly and is considered a wholesome food. However, for people with gout or chronically elevated uric acid, herring represents one of the more consistently problematic fish choices, and its risks deserve clear emphasis rather than being downplayed by its nutritional reputation. The most significant issue is its high purine content. Among commonly consumed fish, herring ranks near the top for purine density, comparable to sardines and anchovies. When purines from herring are metabolized, they are converted into uric acid, and in gout-prone individuals this conversion can lead to a rapid and pronounced increase in blood urate levels. This rise increases the likelihood of monosodium urate crystal formation in joints, which is the direct trigger for gout attacks. Many patients identify herring as a repeat offender, meaning it reliably provokes symptoms even when eaten in amounts that might seem moderate. Pickled and preserved forms of herring add another layer of risk. Curing, pickling, or fermenting does not reduce purine content. Instead, it preserves it. In some cases, these preparations may even make purines more bioavailable. Pickled and matcha herring are also typically high in salt and often eaten in oil-based sauces or with refined carbohydrates. High sodium intake can worsen fluid balance and, if overall hydration is insufficient, reduce the kidney's ability to excrete uric acid effectively. This combination of high purines and impaired urate clearance significantly raises the chance of a gout flare. Portion size and eating patterns further compound the problem. Herring is frequently consumed as part of appetizer plates, sandwiches, or buffets, where it is easy to eat repeated servings without recognizing the cumulative purine load. Because it is often eaten cold and in small pieces, it may not register psychologically as a large protein portion, yet the metabolic impact can be substantial. Regular intake, even in modest portions, can gradually elevate baseline uric acid levels, making gout attacks more frequent and harder to control over time. It is also important to address the misconception that omega-3 fats in herring protect against gout. While omega-3s have general anti-inflammatory benefits and are valuable for heart health, they do not block purine metabolism or prevent uric acid formation. For someone with gout, the inflammatory process triggered by urate crystal deposition outweighs any anti-inflammatory effect from omega-3s. This explains why people can experience severe gout flares after eating herring despite following an otherwise anti-inflammatory diet. Herring is commonly consumed in social contexts where alcohol is present, particularly beer or spirits. Alcohol independently raises uric acid levels and reduces renal excretion, dramatically amplifying the effect of purine-rich foods like herring. This combination is especially risky and is a classic trigger scenario for acute gout attacks. For individuals with established gout, repeated exposure to this pattern increases not only flare frequency, but also the risk of long-term joint damage and urate deposition in soft tissues. From a practical management perspective, herring should be avoided entirely during active gout flares and in the immediate recovery period afterward, when uric acid levels are often unstable. Even outside of flares, intake should be limited and treated as occasional rather than routine. Some gout-prone individuals find that they cannot tolerate herring at all without triggering symptoms, making avoidance the safest option. Hydration, urate-lowering medications, and overall dietary control help, but they do not fully neutralize the risk posed by herring's purine load. The nutritional benefits of herring can be obtained through alternatives that are less disruptive to uric acid balance. Omega-3 fatty acids can be sourced from fish lower in purines when eaten in moderate portions, or from plant-based sources such as flaxseed, chia seeds, walnuts, and algae-derived supplements. Vitamin D and iodine can be supplied through other seafood, dairy, fortified foods, or supplements when appropriate. These substitutions allow individuals with gout to meet nutritional needs without repeatedly provoking uric acid spikes. In summary, herring, including pickled and matches varieties, is nutritionally rich but poses a high risk for people with gout or elevated uric acid due to its high purine content, preserved forms, typical portion patterns, and frequent pairing with alcohol. For effective urate control and long-term joint protection, herring is best avoided during active disease and strictly limited overall, even though it is often marketed and culturally regarded as a healthy food.